The U.S. mainland is in the grips of an opioid crisis. An alarming number of people are addicted to these painkillers, and overdoses have soared by more than 30% over the past few years. Police Chief Steve Ignacio says it's no longer a threat to Guam, it's here.
We know of at least 2 cases on Guam of fentanyl overdose.
He says customs and federal agents have also confirmed multiple fentanyl seizures. What the bill by Speaker Therese Terlahi and Senator Chris Barnett would do is help first responders prevent deadly opioid overdoses through the use of antidote drugs known as naloxone or Narcan. Chief Ignacio says, ironically, they have the drugs on hand, but current law doesn't allow GPD to dispense them as they're controlled substances.
Unfortunately, when something as important as Narcan doesn't get into the hands of police officers and the police officers are exposed to or run into a case or called to a case of an opioid overdose, this life-saving sprays or opioid antagonists sit on a shelf and we can't disperse them.
Guam Memorial Hospital legal counsel Jeremiah Luther says similar laws have been passed in all 50 states, as statistics show that providing the antidote drugs to first responders to use saves lives.
There is some trepidation from healthcare professionals in GMH about placing a drug into the hands of non-trained individuals or individuals who don't have extensive medical training. And so I wanted to express that concern. And it should not be minimized that this is a pretty extreme step, but as I stated in my statement, this is necessary because the downside is that we have unnecessary deaths.
He agrees that all first responders should be immune from civil or criminal liability for dispensing the antidote drugs. All training would be provided by the Guam Behavioral Health and Wellness Center. Authorities believe it's not a question of if, but when the crisis bubbles up. And Attorney Luther says his home state of Tennessee is an example of a place that has been ravaged by opioid overdoses.
And this is a good step, a preventative measure, because like many other members here on the panel, I believe that the opioid crisis has not fully reached Guam, but it is inevitable.
Nestor Lecanto, KUAM News.